Active charts. What's active? When do we deactivate? When do we get rid of them? When do we decide that we're keeping them? Man, there's a lot of things that go into this. In this week's tip, we're going to teach you when do you actually deactivate a chart. Stay tuned. All right, deactivation, active charts. Jeez, man, we get this a lot. When do we deactivate a chart? I could tell you, I've been to a lot of practices, and they deactivate charts for the craziest reasons. I will open up patient software, and I will read deactivated charts, and it will be crazy excuses. Called the patient 3 times. They never called me back. Deactivate. Patient has a balance. They haven't paid it yet. Deactivate. Patient hasn't been in 6 months, a year. Deactivate. Like, it's just wild. Like, absolutely wild what deactivation is. And then, more importantly, who deactivates? And so we run into a problem of we're just wasting charts, and then we're just deactivating for reasons only known to the person that deactivated it. They don't even really sometimes put in a reason. It's just deactivate. And okay, fine. So what we want to do is we want to put a couple protocols in on deactivation. 1, we have to decide that there's only one person that can deactivate a chart. Now, typically that should be the owner. That should be the dentist. It's not always the most likely scenario. In this day and age, with practice management software, you can set security protocols. One of those protocols will be who can deactivate a chart. So I would suggest that you make it your office manager or your most trusted person. Only the doctor, owner, and the office manager should be able to have the ability to even deactivate a chart. Okay, good. So we handle a lot just by doing that. I can't tell you how often just staff get the idea and they've been there long enough and they're, I'm going to deactivate. Okay, good, no more. So it has to pass a test to deactivate. Well, what's the test to deactivate? Well, there's 5 reasons that you should deactivate a chart. Okay. Reason number 1, well, they pass away. Pretty self-explanatory, easy. Good. Reason number 2, well, they request it. They ask to be deactivated. They ask to be removed. Fine, easy, right? Deactivate the chart. Reason number 3, they move away. Well, if they move away and they're in another state and they're in another area, fine, let's deactivate the chart. Reason number 4, they ask to transfer records. I mean, that's an indicator they found somebody else, they're going to a different practice, let's deactivate. Reason number 5, the doctor decides to do so. These are the only 5 reasons a chart should ever be deactivated. We spent a lot of money to acquire all of these new patients and patients into the practice. We just don't want to throw them out because of some idea that we should. So we don't deactivate charts unless they meet those 5 criteria. It's really important. I can't tell you how many times I talk to doctors and they've had a patient that's walked in from 5 years ago, right? So your best source of new patients are patients that haven't been in for a while. So we don't ever want to deactivate charts. We don't ever want to just purge the system unless they meet these 5 criteria. You may not think that they're your patient any longer, but they still think that you're their dentist. So don't deactivate the chart, okay? And then let's start some reactivation. Let's start some reach out. Let's get these guys back in. There's a lot of wasted patients at a practice, and it's really important that we do everything that we can to get them to come in. Let's not shoot ourselves in the foot by deactivating charts. I'm going to put a link in the description for our reactivation program. You can download it. If you have any questions about it, you can reach out to me. I'll walk you through how to do it. It's really quite simple, and it has an amazing effect on getting more patients into the practice. But if you really want to learn everything about attracting, acquiring, and retaining quality new patients, or patients in general, then take a look at my new patient workshop. It's a fantastic 2-day workshop that will teach you exactly that. If you like today's tip, I'd like you to smash that like button, click subscribe, get notifications when our next tip comes out. I look forward to seeing you in the future, and I hope this helped.